Well, actually, the eHR shared record surveys actually is initiated by the eHealth Consortium. And actually, we attempt to survey on the private sector. There are about 4,000 clinics in Hong Kong, solo practice in majority of them. So we would like to see how their reaction to the concept of electronic health record sharing will affect them, whether they have interest in them, what do they think about the sharing. So we sent out about 4,000 letters and emails and wait for the response. And so far we have managed, in the first survey, we managed to get 350 responders, and they give us a very good and favorable results. And our second part, we dwell deeper into their behavior, their attitudes, and we managed to get back 168 responders. And they also give very good response. So finding the most happy thing is that we have noted more than 90%, or practically the majority of the private doctors are very willing and thinking that eHR sharing is good for the patient and good for the medical service. And moreover, about 70% of them will think that they have an eagerness to learn about this eHR in both the techniques, the knowledge, and the skills that they may be lacking. So in 20% of them, even though they claim that they may not have time to learn, but they will certainly very happy to send their clinic assistants to learn about project. So we also ask about whether they know the government's initiative, that really they are anything learning that the government is going to have this master plan of eHR surveys. And also about 70% of them, they already learn about this initiative as also in support of this major project. Well, from a survey, we can conclude that really the private practitioners and the healthcare providers really need more education in terms of eHealth. And secondly, they will very desire to have more technical support from the government, from the IT sectors, so that they can perform this future IT eHR sharing with more confidence. And certainly they will also vow to the government that the government should take the lead in giving out more resources, in supporting education, in supporting technology support, that sort of things, so that in order to make it success. So certainly better initiative or better incentives should be provided to the government to attract more and more doctors into the sharing system. And also the professional associations, the academic societies should also take the lead, try to unite the whole profession together for the betterment of healthcare IT implementation in Hong Kong. Well, I believe the community, like the patients, the doctors, the healthcare providers, should actually can do more. And in fact, the patients should also learn more about eHealth. They should know what it is, what are their rights, what are the concerns, what's the pros and cons of digitalize their medical records on the IT platform. So in order to gain their support, the healthcare providers should also start to equip themselves with the required knowledge and skills, so that they cannot be computer illiterate anymore. Even older generation of doctors, those who are not get used to using computer, should at least start to learn about this, because this is will be the future of medicine. Because I believe medical digitalization, IT, and eHealth adoption will certainly transform healthcare into a safer, quicker, and also more robust healthcare system, actually to make sure everybody is healthy and safe.